inside the gland. That means resistivity index will go up. That means arterial supply will be impaired. When there's an arterial supply impaired, that's no good. No good. Okay? Understand, the thyroid gland will produce the hormone, right? That hormone needs to go to the all over the body. That's why venous blood from the thyroid, it carries the hormone and it spreads all over the body. And if the venous congestion is there, vein is not carrying the blood anymore into the right atrium, because of the right atrium is not taking the blood, so that thyroid function will be interrupted. So this is vascular, very important informations I just gave it to you. So now I will talk about the neurovascular bundle. There are some nerves, it runs along with the vein and artery. There are major neurovascular bundle and the minor neurovascular bundle. So, neurovascular bundles. Okay, I am still in anatomy. Neurovascular bundle has major neurovascular bundle and minor neurovascular bundle. The major neurovascular bundle has three structures. One is common carotid artery, internal jugular vein, and the vagus nerve. Vagus nerve is one of the extracranial nerves out of 12. There are 12 extracranial nerves. They arise in the brain and they come from the brain through the skull and they supply our body organs. So this is vagus nerve, and the minor neurovascular bundle is, it is also 3. Minor neurovascular bundle is inferior thyroid artery, inferior thyroid artery, inferior thyroid vein, and recurrent laryngeal nerve. This recurrent laryngeal nerve, this is nerve supply the larynx. Then what is the clinical importance? The clinical importance is patient may come to the doctor. Doctor, I don't know, from last night my voice is changed. My voice was not like that. Why? Hoarseness of the voice. This recurrent laryngeal nerve passes by the posterior part of the thyroid gland. Posterior part of the thyroid gland of the lower pole. So now if there is a mass growing in the lower pole, so then what happened? No, it's not lower pole. I mean it is posterior to the, it is posterior to the thyroid gland. all through. So now recurrent laryngeal nerve is passing posterior to the thyroid gland, and if there is a mass in the thyroid gland that is growing and extending to the posterior, so then what's going to happen? The laryngeal nerve will be invaded, and that nerve supply the vocal cord, larynx. So what's going to happen? The voice change. That's why it is one of the indication is voice change. If they have voice change, so this is one of the indication for thyroid check. And another indication, we'll give the list. So this is neurovascular bundle. You need to know this because they ask question from here. Recurrent laryngeal nerve. Now I will talk about the landmarks. During the scanning time, what are the landmarks will guide us to understand that this is thyroid gland, this is anterior to the thyroid gland, this is posterior to the thyroid gland, this is medial to the thyroid gland, this is lateral to the thyroid gland. We understood that thyroid gland is anterolateral to the trachea. So that means trachea is here and thyroid gland is here. So automatically trachea is in the medial side. And these are the major neurovascular bundle: common carotid artery, internal jugular vein, and the vagus nerve. So sonographically, if you want to see the vagus nerve, you can see that vagus nerve along with the common carotid artery. So boundary of the lateral side of the thyroid gland is common carotid artery. Medially it is trachea, laterally it is common carotid artery and the jugular vein. Okay, and we'll understand that skin is anterior to the thyroid gland, right? So this skin under surface, the underneath of this skin, there are three muscles, small muscles known as strap muscle. On the right side, on the left side. They pass anterolaterally to the lobe of the thyroid gland. And there's another big muscle here. Look, this is another muscle. What is the name of this muscle? Sternocleidomastoid muscle. Sternocleidomastoid muscle is lateral to the thyroid gland. So there are muscles, straps muscle, which is a combination of three small muscles. They are anterior to the thyroid gland, a little anterolaterally. But there is another big muscle. This is sternocleidomastoid muscle. This is completely lateral to the thyroid gland. And there is another muscle called longus colli muscle. Longus colli, which is posterior to the thyroid gland. So these four muscles you have to remember. Okay. So now, landmarks. Vessels landmark. Common carotid artery, which is lateral to the thyroid lobe or lobes, and common carotid artery has a thicker wall than the internal jugular vein. And number two, internal jugular vein is located lateral to the common carotid artery. and that means it is also and lateral to the thyroid lobes. Okay, these are the vascular landmarks, and there are okay, don't put 2 here, you can give A and this is B, and number 2 muscles. A strap muscles. You don't need to know the 3 strap muscles. I have the name. There's a sternothyroideus, sternohyoideus, and omohyoideus. It is very tough to remember. Okay, just know the strap muscles, all those 3 muscles. Okay, still I'm writing. In future, who knows, you might need to know this. Sternothyroideus. Second one is sternohyoideus and omohyoideus. Okay, what are the other muscles? B is sternocleidomastoid muscle. Sternocleidomastoid muscles and longus colli muscles. Longus colli muscle. So, strap muscles are lateral or anterior to the lobes. Sternocleidomastoid muscles are lateral to the lobes, and longus colli muscle is posterior to the lobes, posterior to the thyroid and also posterior to the esophagus. Sonographically, I will show you that how esophagus is clearly seen when you scan the thyroid gland. Okay, so now I will draw the sonographic view, then you will understand all those structures, and this is the end of the anatomy. Okay, let's draw the thyroid gland. Thyroid gland in transverse view. Doesn't look good. Okay, it is just diagrammatic representation. So this is isthmus, this is right lobe, and this is left lobe. You will see the tracheal ring. It is anterior to the tracheal ring, so you're not going to see, but you will see the trachea over here too. Okay, so this is trachea. The strap muscles you will see the strap muscles, and you will see the sternocleidomastoid muscles. So these three are straps muscle. This is sternocleidomastoid muscles. Sternocleidomastoid in abbreviation. Then you will see common carotid artery and the jugular vein. So this is common carotid artery and this is internal jugular vein. Then you will see the transverse view of the longus colli muscles. Longus colli muscles. And you will see you will see esophagus. Esophagus is seen with the left lobe. I'm just drawing in one-sided, okay? And you'll see this is skin. This is skin. See how superficial the thyroid gland is. It's a very superficial. Okay, so these are the major landmarks you need to know. Okay, I will go over the physiology now. You got it?
Mm-hmm.
Physiology means function. What does the thyroid gland do? How does it do that? Functions. Because it has some industry. Industry of what? Industry of getting the raw materials, synthesis of the hormones, release of the hormones and storage of the hormones. So we will talk about the physiology now. Physiology of the thyroid gland. thyroid gland is an endocrine gland. It is an endocrine gland, means ductless gland, and is the functional unit of the thyroid gland. Functional unit is known as thyroid follicle. Double L. Thyroid follicle. What is that thyroid follicle? If I draw the thyroid gland, this is the thyroid gland in SAS view, then thyroid gland is composed of follicle, and this follicle has cuboid cells known as acinar cells. So these are the follicular cells. These are the follicular cells. They produce hormone. How? They get the raw materials, iodine. From where? From the food. External sources. That's why we eat all the foods that consuming every day. Most of the food has iodine. Same as the salt. Most of the food has sodium, that is the salty, same as iodine. All the seafood, it is sodium, chlorine, fluorine and iodine. Chlorine, fluorine and iodine rich in the seafood. Okay? And in the market we buy the salt. Iodized salt, right? And iodized salt means iodine is added. Why? Because you never know, you might have some iodine deficiency. If you have iodine deficiency, so then hormone by the thyroid gland will be deficient too. That's why we have to have food that has iodine. Good. And iodine is in the soil. The rainwater wash out the soil and all the elements, chemical things are going to the river, and from the river it goes to the ocean. That's why ocean water is salty. Those who lives in the mountainous area, when the rain water comes, so rain wash out the salt into the river. That's why who lives in the mountainous area, they suffer from goiter. Why? Because in their food, cereals, there is lacking of iodine because it's washed out. Okay? So now, this is functional, the follicles. follicles, and follicles has the cuboid cell. You call it acinar cell. The follicle is responsible. So this follicle is responsible. Follicles are responsible for synthesis secretion and storage. So synthesis, it produce T3 and T4. The hormone's name T3 and T4. So T3 is called triiodothyronine. Triiodothyronine, and this is known as tetra. Tetra means 4. Tetraiodothyronine. And T3 is active and T4 is non-active. If it wants to be active, then T3 will be converted, T4 will be converted into T3. So it has to be converted. So now this T3 and T4 will not produce enough if thyroid gland has no enough iodine storage. What is that means? Let me give you the little idea. So we have blood supply of the thyroid gland. So this is blood containing iodine. So this iodine will be uptaken by the follicular cells. So this iodine will go into the iodine inside is uptake by the follicular cells. And this is the only ingredient or raw materials for the T3 and T4. When the iodine is taken into the follicle, there is a series of chemical chain of reaction. Series. And ultimately, the T3 and T4 is produced. That is called synthesis. So now the function is secretion. So secretion into the blood stream. Secretion into the blood stream. Do you think